Okay, welcome everybody. We are back in studio. As you probably seen, there was a last few videos was just Darlene talking, but we decided we wanted to get back into the studio. Um,
Teddy's here with us.
there was a few people that were missing Teddy, so we needed to bring him on,
Yeah.
and so he's here with us as our mascot.
And nice
And
and fluffy.
nice and fluffy. Probably needs a little haircut. But just to remember, we have a functional integrative medical practice, Optimum Health of Utah, here in American Fork, Utah. And we also have O Integrative Medicine that we have recently started as well. And we have some exciting news that we'll be announcing here fairly soon with some telehealth side of things that will be on the weight management side, but that's coming soon. And we're super excited about that. And we'll be bringing more about that. But today, we really kind of wanted to talk about something that Darlene probably hears a lot. It's my labs are normal. You're just getting older. People are asking, why do I still feel awful? And it's become this big thing where, unfortunately, a lot of providers aren't well educated in this. So they tend to just kind of gravitate towards their education where it was very limited in medical school,
Hormones
or
were, yeah.
hormones,
I
things
mean,
like that.
not saying that they're not brilliant. They are. I've
Just
yet to
not their
meet.
wheelhouse.
That is just not their wheelhouse, not their specialty.
Yeah.
Yeah.
So we're going to talk a little bit about that and the frustration that both women and men go through, and kind of talk a little bit about what we do in our practice that we feel is different, that kind of separates us from a lot of the rest.
Mm.
There are great other functional providers out there that do hormones and the whole functional integrative side of things, and they get it. And so we're here just to kind of educate and just kind of bring this to light and provide some solutions. All right, go ahead, take it over.
So, the biggest question that I get from people that come in that have just got their labs from their primary care or from somebody else, they say, why did they say my labs are all normal when I still feel horrible? And so that is the difference between, insurance that is covering, their conditions and when you don't use insurance. So insurance really does require you to be within or outside of a particular range in order to treat and in order to diagnose. In the functional world, we actually want you to be underneath what we feel is your range. So not everybody's range is exactly the same.
Based on symptoms.
Based on symptoms, based on like, oh my gosh, I just feel crappy. I have this horrible pain in my stomach. Just the most interesting things that I have seen come through our door. And I will actually talk about that a little bit later. Examples that are different between normal lab reference ranges and functional ranges would be thyroid. Sorry, excuse Teddy. He likes to chew on my jacket. Thyroid ranges are a little different. Like, for instance, the highest point of the TSH in a reference range through your lab company would be about 4.7. For us is 2. For functional providers is 2. And it's not always just 2. It's based on how you're feeling. So we're going to look at that. Vitamin D, estrogen, progesterone balance, normal levels, but they're not technically in the right rhythm. So they're feeling cruddy. Okay. In Utah, I tell you guys this all the time. In Utah, everybody's deficient in vitamin D, and it comes down to the angle of the rays of the sun. So we need to remember this. You need to be on a supplement if you're not, if you live in Utah. Now, if you live in Hawaii or California, you don't have to, as long as you're outside. So hormones are about balance and timing, not just about a number.
We go to the next section and we talk a little bit about what are other providers, what are they missing? Why is this truly happening? But I'd like for you to explain a little bit why it's important, because we've even had comments that it's pricey, I'm on Medicare, I'm on this, why don't you take insurance? Those type of things. And I think people really need to understand what's going on in the industry right now with insurance and how this whole change with functional integrative medicine is taking place.
What primary nurse practitioners and doctors are missing is that exactly it is the insurance versus the cash pay. You have to follow particular law and rule when you are taking insurance. You can't just prescribe certain things and expect insurance to pay for it if you're inside the normal range of
Right.
the lab company.
It's not much as law, but there's regulations within the insurance.
Well,
What's
it's the
reimbursed? The
insurance law.
reimbursable.
It's the insurance
Yeah.
law. It's not like law
Yeah.
where someone would get in trouble if they prescribed something. Your doctor can prescribe it all day, every day. It's just you'll be paying cash.
Hmm.
Okay. And so cash pay services, I wish that it didn't always have to be cash pay, but that's basically what we do. And we want to do, say your thyroid has been absolutely normal according to your primary. You come in, we notice that it's 4.5 instead of the off range at 4.7. We also check antibodies. When your antibodies are elevated, then we have a diagnosis of Hashimoto's. That's an autoimmune disorder that we need to treat. We need to make sure that your immune system is always where it needs to be. We need to treat that in a completely different way than you would a normal hypothyroid issue. Okay. Sex hormones, estrogen, progesterone, testosterone, and DHEA, all of those are causing or wreaking havoc in not just the postmenopause world, but also the men, also the younger girls, because there's PCOS, there's PMDD, there's a lot of other things. So if you don't take that into account, if you're at your doctor and they say everything's fine, but you still feel like crap and your periods are off, it's important to manage the hormones. And so the hormones are another thing. Cortisol rhythms. We need to make sure that your cortisol is good because if your cortisol is elevated, we need to naturally bring it down. If it's too low, that's another complete different diagnosis that we would have to treat. Insulin and leptin. So, fasting insulin, if that is high, then you have a metabolic disorder. So, we need to treat that in a very natural way, gently bring that insulin down. And so that's another way that doesn't actually have to require a prescription. There are supplements that do this every day, and they're absolutely amazing and very, very comparable to like if you were to use something else that is a prescription, but without the side effects. Okay.
Where does one thing that you've talked about is like inflammation
Mhm.
issues and things like that?
Inflammation. So we always do an inflammatory marker or markers, plural, and we double check to make sure you don't have inflammation. If you do, a lot of times we've got to bring that inflammation down in order to heal to begin with.
Right.
And sometimes that's all you needed, but not all the time. There's a lot of other things that go hand in hand with that.
Yeah. Yeah,
Yeah.
absolutely. Okay. So the next is we've got some kind of patient story scenarios. These are based on real patients when we're not obviously going to share any personal
Yeah.
information, but just to give you an idea, and this may relate to you or somebody that you know and love or friends, family, whatever the case may be. Because if you hear these things or if this sounds like you, then you should really think about coming into and seeing somebody that's on the functional integrative side,
Mhm.
the hormone side. And unfortunately, it's not always going to be your main provider.
Yeah.
Because again, you're going to be limited by what insurance dictates.
Right.
So what are some of these stories and scenarios that you've
I
put
mean,
together for us?
we'll call this first one Sarah. Sarah is a girl in her 40s who has fatigue, anxiety, weight gain. She's getting frustrated because she's having a hard time with sleep, but her biggest issue is stress. So the first thing that pops into a hormone provider's mind is progesterone dysregulation. If you check the progesterone is actually deficient, and we do it around the 21st day of the cycle to make sure we're in the luteal phase. If that is deficient and you start progesterone, you're going to notice a deeper REM sleep. You're going to notice recovery from the day before a little bit more efficiently. Your stress levels go down, anxiety goes down, and sleep gets better. If it's related to cortisol, we check cortisol. So on her, she had cortisol elevated probably about 35 in a morning cortisol. And then in the progesterone, she was very deficient. She was at a less than 0.21. So you need to be between like about 100, I'm sorry, between 10 and 15 around that time, luteal phase. And just the fact that she had come in and this was her follow up after being on it for 3 months, feeling like a new woman, sleeping like a champ, no more anxiety. She always has had still this overwhelming amount of stress, but she's able to deal with her stress better. So I love that about her. That is typical of a lot of my women. Okay.
Hmm.
And that's before she even hit menopause. The first thing to usually go is your progesterone. So if you're starting to feel that anxiety, stress, depression, weight gain, and insomnia, come in because that's probably it. If you're in your 40s, that's probably it. You're starting to decrease in your progesterone levels,
Right.
which puts you in an estrogen dominant state, which is, first of all, is dangerous because you can possibly, if you carry the gene, the ER positive or the BRCA1 or BRCA2 gene, that can possibly trigger that cancer. And if the other things that are just physical would be weight gain, emotional, like mood swings
Mm.
and bloating. So keep an eye on those things when you come in just to keep them balanced. So yeah, so that's
Yeah.
the 40s, the 40-year-old version. I always talk about postmenopause. Well, let me tell you, there's a lot of other people that come in that benefit from hormones as well.
Right.
Yeah.
Been seeing a pretty big wave of younger.
Yeah. Oh, I would love to talk about another girl that came in recently, and she's a young girl, had been having bloating in her belly, thin, lots of pain, no matter what she eats. She's been to GI, she's had X-ray, CT, everything. They even did a celiac test on her, and her test came back negative. So her mom put her back on the gluten, even though the girl had said that she felt better without the gluten. So she was like, "Well, it can't be that, you know." I wish that she would have been told, "Well, if you feel better, don't do it. If you feel better by taking away certain foods, stay away from those foods because chances are you have something called a sensitivity." So we did an IgG test on her for all foods, and we noticed that she has severe sensitivities to all milk products except for camel milk, which was weird, and then all and wheat products. So when you do that, we could obviously do an IgE to see if she actually has a full-blown allergy to it. But I say if you have a severe sensitivity to it, don't eat it. There's no reason why you need to do
Hmm.
an allergy test. Stay away from it. And I feel like just because I told him to stay away from it over the weekend, she noticed complete relief. And I was blown away. Just complete relief just by doing that. So this poor girl had been suffering for years, years
Yeah.
and years. And there was no they couldn't figure out exactly what it was or, they wanted to pinpoint a perfect diagnosis. Sometimes you don't have a perfect diagnosis. Sometimes you have to do something called the elimination diet. Sometimes you don't have to come in for those expensive IgG or IgE tests. Do an elimination diet, see how you feel. And if you feel better, stay away from that food
Yeah.
just completely.
Yep. Okay. The next one, we've got a man in his 50s.
And so he was basically low motivation. And I get these every day, but this one that I'm thinking of specifically was about a month ago. Very low motivation, muscle loss, just really has been feeling cruddy, depressed even. So we checked his testosterone. We checked all of his hormones, but his testosterone was below normal. It was about 250. So his estrogen was also dominant. So we put him on a dimmer and then we put him on testosterone. And he came to me and told me last week that he has never felt better.
Hmm.
So, when someone comes to me and says, "Oh, I'm just getting old," I say, "No, stop that first
Hmm.
and get yourself on track with hormones and functional medicine. And then you'll never even realize that you're getting older because your body's still going to feel like it's 30."
Right.
So
Yeah.
this guy was amazing.
Yeah. Okay. We got our next one here.
And this is a patient with brain fog and sluggishness. That was the main reason that she came in. We checked thyroid. It had always been normal at her primary care physician, and her T3, T4 reversed, and then also her antibodies.
Mm.
So what we found out was that although her TSH was perfectly normal underneath 2, her T3 was very deficient. So that was easy to treat. And then we found out she had Hashimoto because her antibodies were in the thousands. So when your antibodies are in the thousands, you obviously have even it's Hashimoto's, but this would be considered subclinical because her TSH was fine. We still treated that T3. And so she actually feels a lot better with being on that medication.
Yeah, that's great. So with everything that we've been talking about, what are the things that patients can do? Unfortunately, they can't demand that their primary physician run a bunch of tests if it's not covered, or if they do,
Yeah,
they just have to be prepared that insurance won't cover those things.
exactly.
And we had a very similar incident here where you ran a lab, they ran it through, and the person came back and even said that the insurance paid $1,800 of $2,500. So our comprehensive lab, the insurance was saying $2,500. They negotiated it down, or the lab was saying $2,500, and the insurance negotiated it down to $1,800. We only charged $399.
Right.
Yeah,
It's pretty interesting how much more they up the price when you use insurance.
yeah, because of the reimbursement.
Mhm.
And that's what ends up happening. Doctors charge more because they know insurance will reimburse less, and that less amount they have to stay above
A certain amount.
a certain amount, right?
Yeah. Yeah.
So,
But basically, what you can do as a patient, if you don't come to me, which I prefer you come to me, obviously, because I'm everywhere. I can take care of you in most states. But what I really want you to do is go to your primary and basically demand a full hormone panel, a thyroid panel, etc. Make sure that your doctor does have the basic understanding of hormones. For instance, it needs to be on the 21st day of your cycle or between the 18th to the 25th. So remember that. And if they are not aware of that, remind them of it. And if they still don't agree, then you do need to go to a hormone specialist like
yeah,
me.
yeah, okay, perfect. Is there anything else that they can do? You obviously talked about a complete thyroid panel. Ask
Mhm.
about sex hormones. So,
Cortisol
yep,
testing, and track your symptoms across your menstrual cycle so that we know how you're feeling throughout each
right,
each stage of the cycle, and sometimes that can help me diagnose PCOS and PMDD.
right. Okay,
Okay.
perfect. All right. So, what are some? We've talked a lot about a lot of things, and we really kind of want to just put it down to some key takeaways. And
Mhm.
what are those?
Okay, normal doesn't always mean optimal, okay? Because normal on the labs going through a lab company reference range is going to be completely different than an optimal range. So remember that, especially with hormones. And remember that hormones influence nearly everything in your body: energy, mood, weight, sleep, mental clarity, sexual performance, everything. Anxiety, stress, depression. So all of that stuff is extremely related to hormones. And then if you kind of have somebody who sits down with you and talks to you about everything instead of just calling you, labs are fine, and that's from a medical assistant and not even the physician, then I would 100% think about going to somebody who's functional, who will sit down with you, talk about your symptoms, and then talk about, in comparison, your labs. Because those symptoms and those labs together equal your protocol and what we're going to
More
write for you.
personalized for them, a
We
clear
need
picture.
a clear picture of what is going on with you and not just your labs, because your labs and me calling you on the phone and saying everything's normal isn't fair to you.
Right,
So that is why I do what I do. And I know it's a lot more work for me to do what I do, but if I didn't love it, I wouldn't do it.
right.
So it's
Yeah,
amazing hearing people say, "I feel so good. Thank you for what you did. I'm gonna, from the rest of my life on, from this point forward, I'm never gonna say I'm getting old." And I
yeah.
I had someone tell me that yesterday,
No, that's
and
great.
so that made me happy.
Yeah. So, as we kind of come to a closing, we've talked about a lot of things, and it's not always, how you're feeling and things like that. Those are just normal. You're just getting older. Here at Optimum Health of Utah, Integrative Medicine, we really look at the full picture. How are you feeling? What's your labs look like? Is
Mhm.
there environmental issues? Is there personal issues going on? There's a lot of things that come into place,
Yeah,
and we
for sure.
really want you to understand that we're here to help. And you can definitely, continue to follow us on this page. We definitely would love to have you like this particular episode, share it, subscribe to our channel, turn that notification button on,
Mhm,
so that you'll get the latest and greatest of what we're doing here.
mhm.
And by doing that, it allows us to continue creating this great content for you.
Right.
And so please definitely consider subscribing to our channel. It really helps, the good old algorithm and all of that. And it allows us to continue to do what we're doing here. And if you have questions, obviously, you can go to our website, Optimum Health med.com, or you can call us at 801-756-1404. You can text us and call us on that same line. And again, we're here to help. Darlene is here to help, and we really love what we do. And we've got some, again, more exciting things coming down the pipe, and we're super excited about where this is all going. And we really want to continue to provide that great education for you. So,
Yes.
all right. So we love that you were able to stay along with us on this one, and we look forward to seeing you next Sunday and on our next episode. And Teddy's sleeping here, but we'll see you on the next one.
Love you.
Love you.
Bye.